Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, one of the questions I get about all kinds of injuries, be it the shoulder or the knee or the ankle, it doesn't matter what part of the body is, what do I do right after I get hurt? You know, it's not even so much do I go to an emergency room or go to a doctor, but do I put ice on it? Do I take, anti-inflammatory medications? Should I stay home from work or from school? And should I avoid putting weight on it? And those are all very, very valid questions. And so for this Ask Dr. Geier video, I want to talk about one of those particular questions. Basically, can I bear weight after suffering a serious knee injury? Okay, Casey in Lincolnshire, United Kingdom asks, I have a serious knee injury due to a bad slide tackle from an opponent while playing football. I have acute complete tears of the ACL and the MCL. I also have a peripheral red zone tear of the medial meniscus, and I have a large joint effusion. I was wondering if it's okay for me to walk on it. The doctors are still unsure what to do with me. I'm in a hinged knee brace and I'm in a lot of pain. Well, that's a terrific question, and we've talked about those injuries. The ACL injury, that's the anterior cruciate ligament. We've talked about the MCL, the medial collateral ligament. We've talked about the meniscus, the C-shaped shock-absorbing piece of cartilage in separate Ask Dr. Geier videos before, so I won't talk about the end treatment of all those injuries, but I think what's important about this is the first day or the first 2 days after suffering injury like that and what you're allowed to do. So Casey has gone to a doctor, which I completely think is a good idea with a really serious injury, and found out what it is. She was placed in a hinged knee brace, which for a serious knee injury where there's ligament damage and the knee's potentially unstable, is really important to help provide stability to the knee. But the question about bearing weight gets to the question of, are you doing more damage by putting pressure on it? And there are some things that's potentially a problem. If you have fractures around the knee, like the top of the tibia, the tibial plateau, potentially you would have to be non-weight bearing. And you could make an argument after an ACL injury, especially early, maybe you limit weight bearing. I don't worry that necessarily putting weight on it, either just standing and putting your foot down and putting a little pressure on it, or even walking is potentially harmful. The argument would be you potentially make it more uncomfortable. So a lot of times early on, crutches can be really helpful, and you limit weight bearing just to get the pain better, and maybe that helps with the swelling. I don't think, assuming you're in a knee brace so that your knee doesn't buckle though, I don't think that putting weight on it is particularly harmful. We're not talking about jogging, we're not talking about playing sports, we're just talking about standing still, maybe use crutches, but you put some weight on it, and maybe you put some gradual pressure. As I've said a number of different times with ACL injuries, the problem isn't ultimately pain, it's not knee stiffness, it's not strength. The ultimate problem is knee stability. But walking straight ahead typically isn't an activity that causes the tibia to shift out of place from under the femur, so the knee doesn't usually give way, and weight bearing generally isn't going to do any harm for that. The meniscus tear can cause pain with weight bearing, but again, in relatively full extension like you're doing with walking, you may not basically catch that tear between the femur and the tibia, and you're not twisting or doing a deep knee bend that causes pain. So again, a lot of times just walking with a meniscus tear is not particularly problematic. There's a lot of variations, and sometimes the recommendations from us as orthopedic surgeons depend on the specific nature of the injury. So I think it's important to talk to your doctor about whether or not weight bearing is allowed. But just generally, some simple weight bearing to basically start getting you up and around a little bit and using your leg, I generally don't think is necessarily a bad thing. But again, talk to your doctor. Now, have you suffered a serious knee injury, and did it affect your ability to bear weight in the first day or 2 days or even a week? And what did you do about it? Did your doctor allow you to bear weight on it? I'd love to hear your experience. So below this video, leave what happened to you, leave your experience. It could help other people that are watching this video have an idea potentially of what to do if they suffer a serious knee injury. And along the same lines, I would really appreciate it if you'd share this video basically, if you know somebody, maybe you have friends or you have a family member that has suffered a serious knee injury, share this video with them so hopefully it can help them, make a better decision or better understand some of the issues in the first couple days after they suffer their knee injury. Now, if you like videos like this and you want more information on injuries and injury treatments and injury prevention in sports and exercise, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to share those directly with you. And finally, I share so many resources, so much content on ways to stay healthy and perform your best. And a lot of that I share directly with people on my email list. So go to my website, drdavidgeier.com. At the very top of the page, you can enter your name and your email. It's completely free, and I'll share those resources for sports and exercise directly with you. Thank you so much for watching. I really hope this was helpful, especially if you've ever suffered a serious knee injury, and I look forward to communicating and connecting with you in one of these Ask Dr. Geier videos right here next time.